Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. For the last few weeks, we've been talking about cardiovascular health, and we've kind of gone through several different topics. And I want to really thank you for your involvement, for staying with us, for being so engaged, for tuning in, just following us in what we're doing. I think it's really, really important that people, especially Nigerians, really get a firm grasp of some of these conditions, these diseases that plague us in great amounts in this country, not just in Nigeria, but sub-Saharan Africa. As you look at the indices and the matrices and the statistics, they all point. They are very grim. They're pretty gloomy when you look at them. We are number one, and in Nigeria especially, when it comes to cancers, especially breast cancer and prostate cancer. We tend to develop them at an earlier age. They tend to be more aggressive. They tend to be more, patients are more resistant to treatment. Not just for those two cancers, but other cancers as well. We also know, coming to cardiovascular disease, we now know for the first time ever, cardiovascular disease, including heart attacks and strokes, have cracked the top 5 causes of death in sub-Saharan Africa. How about the other things like sickle cell disease? We're not just talking. We're not even touching the infectious diseases that many governments are doing a good job of trying to curtail. But these, what they call non-communicable diseases, like cardiovascular disease, cancer, and even mental health. I forgot that. Mental health disorders, neurological disorders like schizophrenia, depression, now autism, cerebral palsy in children. They are still on the rise. In fact, they are worst in West Africa. So it's critical. I said all that to say this. It's critical that the average person, the lay person, understands these, shall we say, fundamental principles, these rudimentary principles about health. Understand, one, how their bodies work, how their brains and bodies work, how their what it takes to keep their bodies functioning, the nutrients, one, but also movements and the relationships. All those things that we sum up in the teaching called the laws of life, and we'll teach about that sometime. But also, we also need to know what the risks are to us, especially as Africans and Nigerians. What are the things that make us more prone to these disorders? We need to know those 3 things: how our bodies work, what our bodies need to work well, and number 3, the risk factors, the toxins, the things that are mitigating or attacking our health. And we hope to cover these as we go along. So please continue to stay tuned. These are very, 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 very important. One of the things too that I was always concerned about was why. What are the specific things that make us more prone to these conditions? And I asked my cardiologist friends, both in Nigeria and outside the country, and the answers they gave were varied, but none of them really seemed to satisfy me. Some of the answers were like, well, we're now becoming more westernized in our lifestyle, so we eat more of the junk food and burgers and all those things. And that kind of made sense, but to me it just wasn't enough. And I think I've mentioned this in prior episodes, that there are people who are in the Western world who are vegetarians, for instance. Some of you know Ben Carson, Dr. Ben Carson, who was the famous neurosurgeon and now eventually ran for president, and he's presently in the Trump's cabinet. He was a vegetarian. He was extremely fit. He exercised pretty much every day. He had a good job. Finances were not a problem. And yet, he still came down in his mid to late 30s with aggressive prostate cancer. There's another well-known preacher called Creflo Dollar. He also went public with his issues with prostate cancer, again before the age of 40. These are people who already were doing the right things. So it couldn't, in my opinion, it couldn't just be chalked up to a westernized diet. And I had patients here too, like I said, who were doing everything right, and they were on antihypertensive medications, 4 or 5, and still not working. So it got me to really, like I said, dig into the literature. Where I had to do a lot of research and ask people both within the medical field and in the research field and in the nutritional field. And I think when it comes down to the basic principles that we talk about, I think when it comes down to that, we need to understand what we can do, what is in our power to do. The truth is, our healthcare system is not comparable to the Western world's healthcare system. If someone has a heart attack, if someone has a stroke, there's a greater chance that they die from it. And even if they don't, there's a greater chance that they have mortality and morbidity. In other words, they are more likely to have long-term disabilities from these conditions if they survive. But my thought is, what can the average person on the streets do? What can they take in so that they can be aware of and prevent, and quite possibly really, really make it difficult for them to have cancer and heart disease, or cardiovascular disease and stroke, or a mental health condition. I think there are basic principles that we can apply. And if you haven't caught up, please be sure to go on our social media pages. You can find some of these answers on the website and on the social media pages, some of the past episodes too. And we're going to go into the next few segments of this program. I'm going to again share our thoughts, kind of wrap up all we've been talking about with regards to cardiovascular disease, and hope that makes sense, and I hope it's something that you will be able to take hold of. So we'll be right back. Stay tuned.